Hi, I'm Emily Simmons from the Department of Interprofessional Practice and Training. In our department, we coordinate programs related to the Age-Friendly Health System Initiative. We are excited to share with you a few key initiatives related to age-friendly care so that you can incorporate these into the care that you provide to your patients. As you probably heard, the aging population is growing. Age 65 and older in 2019 was 16% of the population. In 2040, that is projected to be 21.6% of the population. The fastest growing age group is actually our 85 and older group. People aged 55 and over are 29% of the population, but they account for about 56% of healthcare spending. Healthcare organizations have a responsibility to make sure that we are putting processes in place to meet the needs of older adults so that we can make sure that they are receiving high quality care. This is a very busy slide, but on this slide, it shows all the changes that happen in each body system as we age. This does not take into account how disease processes affect the body. These changes are the reason why standard care that is delivered to younger adults is not always the most appropriate care for older adults. Medications often are not metabolized in older adults the same due to changes in kidney functioning, so certain medications that can increase the chance for falls and delirium. For example, Benadryl is a medication that can cause a lot of negative side effects in older adults, so it should be avoided unless the patient is having an allergic reaction. The loss in lean muscle mass also makes the older adult patient more at risk for functional decline when they're not getting out of the bed. Also, we know within our older adult population that there are patients that are more at risk. We look at patients who are functionally intact, which means they have the ability to do their own basic activities of daily living and care for themselves, or patients that are cognitively intact. They do not have any cognitive impairment. They are usually more patients that are healthier that have a little bit of more room to spare, like you see in this picture. So maybe they receive a high risk medication or spend a day or two in bed, and they have the ability to kind of come back from that and not really have those long-term negative effects in comparison to someone who is functionally impaired or cognitively impaired at baseline. Those patients really have no margin for error. Those who we call these pointy tip people, they're on that kind of edge of the cliff. And if they receive a high risk medication like Benadryl or spend a couple days in bed, it really may change the trajectory for them. And they start this kind of spiral of functional decline, which is really hard to overcome. We also know from the literature that older adults that are in the hospital can really experience some negative outcomes. One of those things are delirium. Delirium mortality for hospitalized patients is really somewhere between 22 to 76%, which is similar to an acute MI or sepsis. And the 1 year mortality is 35 to 40%. Patients who develop functional decline, which means they have a dependency in at least one activity of daily living when they leave the hospital, have a 42% chance of being dead at 1 year. Functional decline is tied hand in hand with mobility. Patients who do not get up and move throughout the hospitalization are at risk for functional decline. There is also a great opportunity to make sure our healthcare providers understand what are those best care practices for older adults. So we have to make sure we're utilizing processes to train our healthcare providers on age-friendly care. The Institute for Healthcare Improvement created this age-friendly health system initiative several years ago. The goal of this initiative was to build a social movement so that all care with older adults is age-friendly care. This care should be based off of evidence-based practices that cause no harm and aligns with what matters to older adults and their caregivers. The 4 M's was the framework created for this movement, and the 4 M's are what matters, medications, mobility, and mentation. I'm just going to briefly share a few overview of the 4 M's, but the additional videos will give you a lot more in-depth information on them. What matters is looking at what is important to the patient and their caregiver. It is important to understand what is important to them related to the healthcare goals so that we can align the interventions that we are doing to meet those goals of the patient. This includes looking at goals all across the trajectory of their health, along with at the end of life care. What are those things that they want done for them at the end of life? The second M is medications. If medication is necessary, we need to use age-friendly medications and make sure those medications do not cause falls and delirium and other kind of negative outcomes. The third M is mentation. Under that, it falls dementia, depression, and delirium. So we really need to make sure we're identifying strategies to identify these things, prevent negative outcomes, and to treat them. And then the last one is mobility. We want to make sure that we're promoting safe mobility in all our patients. So if the patient can get up in the room, that's great. But if they can't, we want to promote that highest level. So maybe that is just sitting on the edge of the bed or sitting in the chair to really help to make sure that we're promoting mobility, which will prevent functional decline in delirium. At UAB, we've been on an age-friendly journey for several years. We opened the ACE unit, which is Acute Care for Elders unit, in 2008. In 2009, we created the Geriatric Scholar Program, which is an interprofessional program that trains our staff at UAB on age-friendly care. Through that program, our scholars complete quality improvement projects, which has helped us align these age-friendly care across our organization so that we truly have a system-based approach. UAB is also a niche hospital, which is Nurses Improving Care of Health System Elders. And in 2019, we became an age-friendly health system committed to care excellence organization. In 2021, we achieved Geriatric ED Level 1 accreditation at UAB Highlands ED. We're very excited to achieve this accreditation, and we were the 17th hospital in the whole world to achieve that level of accreditation. So we truly have taken on this system-based approach to look at the 4 M's and spread this across our organization. And so we hope that you really take time to look at these toolkits and help us implement these 4 M's in the patients that you're caring for at UAB. And it takes an interprofessional approach to address these 4 M's. They're all interrelated. And so it really takes that nice looking at it comprehensively. So we welcome you to join us as part of our team to help address these 4 M's in our patients. And so we really thank you for the time and for you going through this toolkit.